Dr. Paul Summergrad is the Francis S. Arkin Professor and Chairman of the Department of Psychiatry and Professor of Psychiatry and Medicine at Tufts University School of Medicine and Psychiatrist in Chief at Tufts Medical Center. He has served as the 141st President of the American Psychiatric Association and is a past President of the American Association of Chairs of Departments of Psychiatry. He serves as the Secretary for Finances and is a member of the Executive Committee of the WPA. An international leader in medical psychiatric disorders and care, Dr. Summergrad's research focuses on mood disorders, medical psychiatric comorbidity, and health system design. He has published extensively with over 150 peer-reviewed publications, book chapters, and other communications. He has edited 3 books: the Textbook of Medical Psychiatry, Integrated Care in Psychiatry, and Primary Care Psychiatry. He is a distinguished fellow of the American Psychiatric Association, a fellow of the American College of Psychiatrists, the American College of Physicians, and the Royal College of Physicians, Edinburgh, and has received numerous other awards and honors. He received the Distinguished Faculty Award from Tufts University School of Medicine in 2015 and the Leadership Award of the American Association of Chairs of Departments of Psychiatry in 2018. He was elected to the Honorary Fellowship of the Royal College of Psychiatrists, their highest honor, in 2020.
Hello, my name is Paul Summergrad. I'm the Secretary for Finances of the World Psychiatric Association, and I wanted to give you a report about my areas of responsibility within the World Psychiatric Association. As you know, there is no way in the current environment for any of us to be unaware of the great trauma and difficulty that the world has been going through. We are primarily meeting remotely for many meetings, and people have begun to come back for in-person meetings. The world has been upended since January of 2020 as we have lived through this global pandemic. Even as we speak today, while millions of people and billions of people across the world have been vaccinated in many parts of the world, there is an inability to manufacture or to provide needed vaccines so that we have the type of global equity and health that not only our common humanity require, but even if we were looking at things from the standpoint of self-interest require. All of us have to be healthy, or none of us can be healthy. So I speak with you about the issues of finances for the WPA and the role of the WPA in world psychiatry, primarily under the awareness and the situation that all of us face of this profound disruption in the lives of our patients. All of us know as well that the mental health consequences of this pandemic have been severe and profound, particularly affecting children and adolescents, but no group has really been removed from the disruption that this has created, whether it's economic, social dislocation, inability to work as people normally would, inability to get assistance and help or to see loved ones as one normally would. It has been a time of trauma for the world, and we are certainly seeing this in the demand for mental health services, hospitalization, and care throughout the world, and something that I expect that will continue for some period of time. Through this period of time, the WPA has, of course, had to manage its finances at a time when we've not been able to rely on in-person meetings for revenue or other activities that would generate revenue for the WPA to allow us to serve all of you and to serve the patients that we all serve together. However, we've been able to maintain a reasonable level of stability within our accounts by also watching our expenses very closely, cutting out travel, of course, and reducing other expenses or that we are not absolutely material or central to the WPA's activity. At the same time, a number of the members of the executive committee, members of the board, members of the organization more broadly, have been involved in a variety of creative activities, including our educational learning platform, development of greater levels of scientific collaboration and research, and coordination with industry and other public partners to allow the WPA's finances to remain stable throughout this period. And for that, we're very grateful to the leadership of our president, Afzal Javad, as well as all of the other members of the executive committee, the members of the board, and particularly the extraordinary work of the WPA Secretariat, led by our CEO, Francesca Sotgiu. So I want to thank all of you for your commitment to the WPA, for coming to this meeting, and for learning together as we all have how to manage through this period. My hope for this next period of time is that we will, through the finance operations, also begin to reach out for, as a not-for-profit organization, reach out for donations and fundraisings that we can achieve with other non-governmental organizations and foundations, also the not-for-profit branches of industrial organizations that have an interest in mental health. Some of that work has already been underway, but we hope that that will be increased in the next period of time. Finally, I want to say that no discussion of the WPA would be complete without talking about the extraordinary role that World Psychiatry, under the leadership of our editor-in-chief, Mario Mai, serves. Just this past week or so, they published an online first report of the risk factors associated with substance use and the development of breakthrough infections in COVID. The impact factor of the journal is now by far the highest of any psychiatric or social sciences journal in the world, close to 50. I think it's at 47 or 48. And the level of detail, thoughtfulness, and publication that one finds in World Psychiatry is unmatched. The reviews, the comprehensiveness, and indeed the global perspective that it provides is extraordinarily important for the future of our field and for our ability to communicate with each other in a way that provides reliable and thoughtful psychiatric expertise and scientific expertise for the care of our patients. So I want to thank Dr. Mai as well for his leadership and contributions. In summary, the finances of the WPA, while under stress, are stable. We have adapted to this current environment, but we know that there is much work to be done, both to enhance the sources of revenue, to make sure that we focus those uses of those revenue in support of the global needs of psychiatry and the action plan of our president. And I want to thank Afzal Javed for the opportunity to speak with you today, as well as my colleagues on the EC for their leadership and support throughout this complex period. Thank you very much.
Professor Summergrad, thank you very much for your presentation today. Thank you.